Well, with the professional team that we have here and our digital technology capabilities, it would be really hard to leave here without teeth. As we plan it accordingly, whether it be permanent, whether it be temporary, whether it be an all-on-5, whether it be one single implant, it doesn't really matter, but we can afford that luxury here with this practice of offering these people permanent teeth upon departure.
There are several instances where we're able to not only provide the teeth, but we're able to actually attach the teeth to the implants that very same day so that patients can leave with a prosthesis that fits well, that they can speak with, that they'll be able to function with much better than they would otherwise with a traditional denture. And I think that's something that patients are really looking for at our practice.
And I think one of the things in the model we're trying to set is that we're going to curtail each treatment to that patient and what they want. And we're not a one box that everybody fits in. We're going to treat that patient. If it's 2 implants and a snap-in denture, or if it's 6 implants and a screw-in denture, we're going to do whatever the patient needs, most importantly, and then what they want. But a lot of the bigger centers around the country offer one solution and one option, and it's 4 implants and you get screwed in teeth. And there's a lot of problems with screwing in the teeth on every patient that walks in the door. We've seen it in our own practice and have changed the way we practice accordingly, that some of these elderly patients with really soft bone in the upper, they're just usually not candidates to screw in the teeth that day. Now, they will leave with a nice looking denture. They're always going to leave our office with teeth, but you can't just put everybody in the same box and get the results that we're wanting to get at Fusion Implant Center.